Hey everyone, today's video is going to be a super quick update on my medical status. I apologize ahead of time if my mic is kind of in an awkward position in relation to me today, but right now I'm not actually sitting in a chair. I'm kneeling on some padding because sitting right now is still something that is not the most comfortable. A few weeks ago, I shared my situation of being diagnosed with prostate cancer, and after reviewing all of my different treatment options with my doctor and medical team, right? We all agreed that having the removal, a surgical removal of my prostate would be in my best interest, right? My best option for given my situation. So that's what I decided to do. And I underwent the surgery almost a week ago. I underwent it last Tuesday. Of course, I was in the hospital overnight. It's a major surgery. And, from beginning to end, the entire surgery took a little over 4 hours. So it was pretty lengthy. Now, if you're not familiar with prostate surgery, there is something kind of pretty interesting about it in, I guess, a weird way. But once you're on the OR table, you're actually placed in a position with supports, of course, but in which your legs are lifted in the air kind of well above your head, right? So your head's kind of still on the table. And that allows your organs to kind of move towards your head and creates a lot more room inside of you for the doctor to go in and perform the surgery. But imagine being in that position for 4 hours, right? Not the most comfortable. At any rate, when you consider everything that my body has been through and the stress, over the past year of dealing with this, I'm happy to report that I'm doing very well. It is a slow recovery. I still have a catheter in and I'll have that in for a few more days anyway, until I have my next follow-up. Obviously still sore around all of the incision sites, right? There's a lot of bruising going on and things like that. And sitting and sleeping are still a little bit of a challenge, right? Because you can only basically be in one position. But I'm up, moving around, doing all those good things to promote blood flow and good healing and all the things that my doctor recommends. So I'm happy about that. All in all, my decision to have the surgery, while not my ideal choice, something I don't regret. I still feel, like I said a little bit earlier, that, my decision to have it was the best for my situation, and I'm glad that I went that route. I want to thank all of you, though. When I shared my last video, your insights, your well wishes, it honestly brought tears to my eyes, and it's something that really moved me. And can't put into words how much it means. I just wanted to share this update, though, and let you know I'm on the mend. It will probably be another 5 to 6 weeks before I'm fully back to myself. But at the end of the day, the cancer is out of me. And, at the end of the day, that's what truly matters. So thanks for stopping by. Again, this is a real quick update, and I will see you in the future videos. But until then, have a great day.